Happy Transformation Thursday, everyone. Yesterday I was talking with a mom about her 3.5-year-old daughter who's been under care now for about 3 months. Originally came in because her pediatrician had recommended neurological chiropractic for her daughter's IBS issue. She could go from diarrhea to pebbly constipation in the same day. She would have tummy pains and eat a little bit and be like, I'm full, mommy. Other things mom noted with her daughter, aside from digestion, were that she had a language delay. She had this tendency to bite all the time. She'd chew her hands, her feet, her nails, her clothes. Prior to coming in, had been put on antibiotics because she chewed the skin open so much. She had a sensitivity to sound, and she'd be in the car and say, "It's too noisy, turn the music off." And then the other thing mom reported is that when she was in the car or at the dinner table, she'd always be gripping. So in the car, she'd be holding on. At the dinner table, she'd have to wrap her legs around the chair to give her body a sense of security. So when we look at this, we say, all right, there's a lot going on in these different categories. What we're going to look at is, instead of treating them individually, we're going to say, let's help your daughter's nervous system start to balance, start to integrate, and get back on track and see how she heals. So when we checked in yesterday, fast forward about 3 months, mom said her language is improving. It's starting to open up instead of fragmented sentences. She's starting to piece things together. Her digestion is starting to be much more consistent. She has decreased her biting a ton. She still gets a little nervous and does some. And her ears are becoming more open. Mom said she'll still cover them, but she's not asking for the music to be shut off. And she noticed she's a lot more confident. She's not gripping and holding the way she used to. So awesome news, of course, for mom and her daughter. And one of the cool things about this is mom was able to simplify things when it came to helping her daughter. So rather than seeing a digestive specialist, maybe a sensory specialist for the ears, or a vestibular specialist, or a core specialist for the gripping, or the nail biting is a common sensory thing as well, or a speech therapist for the language, right? Those can all be great modalities, great therapies to use. But what we find is, if the nervous system is unintegrated, if it's under stress, if it's out of balance, suddenly all these things can start to pop up. And rather than starting by treating them individually, we said, let's work on the foundation. Let's get your daughter's nervous system healing and doing well, and we'll see what's left. So fortunately, she is doing great and she's progressing super well. And sure, she might need some therapy support for one of those things down the road, but right now we know that she's on the right track.